everyone. Welcome to Health 180 with Carrie and Fenn on Rogers TV and podcast. My name is Carrie and Fenn. It's July 19, 2021, and today's episode will focus on a special panel of doctors here to talk about COVID-19 and the vaccine, giving you what you need to know to help you keep your family safe during this pandemic. We want to help you learn more, so let's learn together. Doctors, welcome.
Good morning.
Good morning.
Thanks for the invitation.
Good morning. Let's talk about the doctors joining me today. Dr. Kyle, tell us about the work you do at Durham Region Health Department.
Well, very briefly, Karen, I've been Durham's medical officer of health for close to 30 years. So with respect to COVID-19, in summary, I've led my team together with our partners with respect to the pandemic response, including the vaccine rollout. So that's really been my overarching role, and I use some legal tools such as issuing orders, instructions, and that sort of thing. So that's been my role for the past year and a half, I guess, or close to a year and a half, anyway.
Yes. Dr. Rababaza, tell us about the work you do.
Good morning. I am an obstetrician gynecologist at Lakeridge Health. At the present time, I'm also co-lead of the Inclusion, Diversity, and Equity Committee. I am a founding member and past president of the Black Physician Association of Ontario, and also a former president of the Medical Staff Association. With respect to COVID, I've been part of many initiatives to get the Black communities vaccinated, and also be informed and educated about COVID.
Yes. Dr. Rakuto, tell us about the work that you do at Lakeridge Health.
Good morning, Carrie. So I'm an infectious diseases specialist. So part of my work is to see patients with various infections. I'm also the medical director for infection prevention and control at Lakeridge Health, and the chief medical director for quality and patient experience. So over the last year, the infection prevention and control piece has become more important, and I've spent the majority of my time working within the hospital system, and then also with our community partners in all things COVID.
Dr. Singh, tell us about the work that you do at St. Michael's Hospital.
Hi, Carrie. I'm a hematologist, so that means I'm a specialist in blood disorders, and I have a focus in particular on thrombosis medicine, which is the medicine around blood clotting. So I would say over the past 3 to 6 months, we've been getting a lot of calls and questions from patients and family members and healthcare providers about the vaccines in particular, and about the risk of thrombosis associated with the COVID-19 infection itself.
Let's take a look at the COVID-19 virus. Dr. Kyle, what are variants?
So, Karen, variants are one or more mutations of a previous strain of a virus, in this case, the coronavirus. What makes a variant of concern is that mutation leading to one or more of a change in transmissibility, a change in health outcomes such as increased hospitalization, a change in the immune response, either due to previous infection or vaccination, a change in the effectiveness of vaccine, or a greater difficulty in detecting the variant. So that's what constitutes, if you will, variants of concern.
Dr. Rakuto, we've seen various variants. What can you add to what's causing the virus to change to a new variant?
Yeah, so these mutations that occur with any virus are pretty common. It is just something that happens. With coronaviruses, it actually happens less often than things like influenza virus, which mutates much more frequently. But the biggest reason why we see the emergence of variants is just if there is a lot of virus transmission and activity. So if we have many, many cases, it's much more likely that a variant will come up. And if that variant is better able to spread to others, is more efficient at spreading, for instance, or causing infection, then those tend to come out as a predominant variant. And so we've seen right now in Canada a few major waves. The original variant happened during the first wave. Then we saw the Alpha variant come out during wave 2 and then later on after wave 3 or through the end of wave 3, we've seen this Delta variant become the predominant variant, and it's just better at spreading.
Mm-hmm. Dr. Kyle, we've seen how Canadians are actually getting vaccinated. It's becoming more and more as we move forward. How effective is the current COVID-19 vaccine against these variants of concern?
Yeah, so this is probably more in Dr. Rasciuto's wheelhouse than mine. But with respect to, for example, the Alpha variant, all 3 vaccines licensed for use in Canada have been effective. Of course, effectiveness generally improves after 2 doses as opposed to 1 dose. With respect to the Delta variant, it does seem like 1 dose is less effective than with other variants. And so the push before we leave step 3 of the roadmap to reopening to try and have as many persons as possible have to be fully vaccinated. But it does differ depending on the type of vaccine and based on, of course, worldwide experience. So it's very good, but it does vary, and it depends on the predominant variant of concern that's circulating as to vaccine effectiveness.
Dr. Singh, vaccines are being used to prevent us from getting the COVID-19 variants. Are you seeing any change in the impact of blood clots as a result of individuals getting the vaccine?
That's a great question. One important thing to know is that COVID-19 infection and hospitalization as a result of the infection increases the risk of clotting. So if one was to have a severe infection from COVID-19 and be hospitalized, that's really when the risk of clotting increases. So the most important thing for reducing the risk of clotting is actually vaccination, because vaccination reduces the likelihood, dramatically reduces the likelihood that one will be hospitalized with COVID-19, and therefore the risk of thrombosis decreases as a result. So the vaccine itself does not protect one against thrombosis itself, but because it protects one against severe infection and hospitalization, that's the reason why it's protective against blood.
Dr. Rubabaza, how are the new variants impacting the Black community?
It would be very difficult to determine how a specific variant is affecting a specific community. All that we know is that different communities have been affected differently by this pandemic. And certainly where there were issues of social determinants of health, where there were disparities, these have been much more amplified by the pandemic. So as certainly we've discussed before, and as it is becoming more and more evident even in the medical literature, is that communities with a low socioeconomic status get affected much more than others. And obviously those include the Black communities. And if you were to look at where the pandemic has had much more impact, if you were to look in for instance, in the Toronto neighborhoods, you will find that the impact was much more harsh in communities where there was a bigger component of Black populations.
Dr. Singh, people are really scared, especially those who had blood clots in their lungs. What can you say to those who have blood clots, scared about the new variants, but are concerned?
So this is a common question that comes up. As far as we know, the new variants, including the Delta variant, are not more likely to cause thrombosis than any of the previous variants. As was mentioned earlier, the new variants may be more serious and may have a higher risk of severe infection or hospitalization potentially if one is not vaccinated. So again, the main message would be if you've had a blood clot previously, the most important thing is to prevent a severe infection from happening. And that's really the weapon that we have against that is the vaccine. So I would say the presence of the variants doesn't change that reality, which is that the most protective tool is the vaccine.
Dr. Babaza, I saw a video of someone saying that these babies born during COVID-19 are not the same. Have you seen anything that tells you that the variants have an impact on babies being born?
No, there is no evidence of that. And if there was even to be any effect, that would be too much premature to see that. Any studies on this would take some time. And if we're talking about the Delta variant, the Delta variant has been in circulation. I may be, Dan can correct me on this if I'm wrong, but this has been in circulation for the past 3-4 months. So to say that there is an effect on babies would be too premature to say that.
Dr. Rakudo, how can we prevent future new variants of the COVID-19 virus?
Yeah, so the best way to prevent any variants from emerging is to ensure that we don't have uncontrolled circulation of COVID. So if there's uncontrolled spread, it's likely that more variants will arise. If we can keep the cases very low, then it's unlikely that they will. And this is really through vaccination, but also the other public health measures will still need to be in place, given that there's still a large proportion of the population that's not yet vaccinated. So that includes, the safety measures, wearing masks indoors, for instance, and ensuring that you're not exposing others if you're feeling sick.
This is Health 180 with Carrie and Fan and Rogers TV and podcast. We are talking with doctors about COVID-19 and the vaccine. My name is Carrie and Fan, and we'll be right back.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
When you're online, Rogers TV on YouTube shares news and events from your community, like messages from local leaders, updates on the latest health news, local business presenting their new offerings, and how our local communities are working their way through these unprecedented times. Visit and subscribe to Rogers TV on YouTube for the latest local information.
You're watching Rogers TV.
Welcome back back to Health 180 with Carrie and Fenn and Rogers TV and podcast. My name is Carrie and Fenn. I am joined by a panel of doctors to help inform you on what you need to know about COVID-19 and the vaccines. Dr. Rubabaza, Dr. Rikudo, Dr. Singh, and Dr. Kyle from the Durham Health Department is back with me to keep you informed. Let's talk about the COVID-19 vaccines. Dr. Kyle, what does fully vaccinated mean?
So, Carrie, fully vaccinated means that you have 2 doses. The interval between the first and second doses is as per provincial guidance, and currently is 28 days. So if you have 2 vaccines, then you're considered to be fully vaccinated. And in Ontario, if the 2 vaccines are different, you're still considered to be fully vaccinated.
Dr. Rikudo, we are hearing on the news that some people who are fully vaccinated are getting the virus. Why do you think that is happening, and what can you say to the public to ensure that they know that it is beneficial to get vaccinated?
So those at highest risk still are those that are unvaccinated. And that's not just highest risk for getting the virus, it's also higher risk for transmitting the virus and for getting more severe illness that results in hospitalization or even death. And that's been seen, not just in Ontario and in Canada, but we've seen that across the United States and other highly vaccinated places where those that are unvaccinated are most vulnerable. However, there are those that are fully vaccinated or partially vaccinated that still can get infection. Usually this infection is mild, presenting with cold-like symptoms, while your body is fighting off the infection. That is most people who are fully vaccinated that get the infection. And we're seeing very, very few, if any, severe infections in those that are fully vaccinated. However, not everyone has the same response to vaccine. So if your immune system is very, very weak, for instance, from chemotherapy or someone who's had an organ transplant, for instance, the vaccines may not work as well. You may not be able to mount a response, an immune response to the virus. And so you may still be vulnerable, almost as vulnerable as those that are not vaccinated. So you have to keep that in mind as well. Everyone's a little bit different, but by and large, everyone who has been fully vaccinated is very well protected against severe illness and protected against acquiring or transmitting the infection.
So I want to ask all of you, because I think it's very important for the community to know this. And you let me know as I call your name. Dr. Singh, are you vaccinated?
Yes.
Dr. Rubabaza?
Yes, I'm fully vaccinated.
Dr. Kyle?
Yes.
Dr. Rikudo, are you vaccinated?
Yes, absolutely.
Dr. Rubabaza, in your opinion, why should the Black community get vaccinated?
It is very important that everyone gets vaccinated. The more people vaccinated, the more chance we have to get out of this pandemic. And particularly as we saw that the vaccine had a great impact, sorry, not the vaccine, the COVID-19 had a great impact on on Black communities, on in the communities where with the low socioeconomic status. It is very important that those communities be vaccinated. And vaccinating those communities protect everyone. As Dr. Ruchioto was discussing about the emergence of new variants will continue to emerge if people are not vaccinated. So vaccinating everyone, including Black communities, is very important to come out of the pandemic.
Dr. Kyle, I have an 11-year-old son, and as you know, at that age, you're not fully developed yet. Should I be okay with my child getting the vaccine?
So the short answer is no. The Health Canada regulates the use of vaccines in Canada, and the only vaccine that's recommended for the teenage group, 12 to 17 years old of age, is a Pfizer vaccine, but you have to be, because of licensing, and this is based on clinical studies, trials, and that sort of thing, you have to be 12 years of age or older at the time of immunization. So don't know where in the 12th year your son or daughter is, but they're going to have to wait until they turn 12, as I say, from a licensing perspective and authorization for use in Canada. And it has to be the Pfizer vaccine currently until another vaccine is recommended or approved for use in Canada.
Dr. Singh, we heard about some people getting blood clots from taking the first dose of AstraZeneca, and it was pulled for a while. Is the risk of blood clots higher or lower from getting a second dose of AstraZeneca?
Thank you for bringing this important point up. As you mentioned, there were reports of very rare but serious blood clotting events happening after the first dose of the AstraZeneca vaccine. Currently, in areas where the second dose of the AstraZeneca vaccine is being administered, the risk of clotting is far lower with the second dose than with the first dose. Now, that being said, in Canada, we haven't been offering the AstraZeneca vaccine, and more recently, it's just been the Moderna and Pfizer vaccines that are available in Ontario. And those vaccines that are currently being administered have not been shown ever to be associated with clotting events. So I just need to reiterate, the vaccines that are currently being administered in Ontario are not associated with any of these very rare clotting events.
Dr. Kyle, Pfizer is seeking approval for a booster shot. What are your thoughts on the booster shot, and do you think people need it?
So thanks for the question. I think it's too early, at least for me, to comment on the need for boosters. The scenarios you'd be looking at would include, even if somebody is fully vaccinated, there's evidence that the immunity is short-lived, and so the immune response needs to be boosted. If there is a new variant of concern, and it's of concern because the vaccine effectiveness related to the current vaccine is lower than it otherwise would be, or the immune response is lower, then that may be a circumstance where you would require a booster dose. Internationally, I know that some countries consider the use of different vaccines for two doses to not afford adequate protection. So there may be international border reasons for having a third dose, which is the same as, say, the second dose. Those are some of the scenarios that I can see of, but I don't have a line of sight with respect to what would be the circumstances and why in Canada would a booster dose be authorized for use. We usually turn to scientific bodies such as the National Advisory Committee on Immunization. So I look forward to it wading in if and when appropriate.
Dr. Singh, should someone who have a history of blood clots and taking blood thinners get the booster shot? Is this something that should be considered?
By booster shot, you mean like a third dose of the vaccine, or you mean the second dose?
The booster shot that Pfizer is talking about implemented, they were trying to get approval for it.
I see. Absolutely. Second, third dose. As I said previously, the Pfizer vaccine has not been, and Moderna vaccines have not been associated with an increased risk of clotting. So 100%, if you've had a blood clot, and even if you're on blood thinners, you should certainly receive the vaccine, booster vaccine. Absolutely.
Dr. Rubabaza, what is the data pertaining to the percentage of the Black community members receiving COVID-19 vaccine?
Very good question. We do not really have that data, though we've been advocating for racialized based data in terms of healthcare provision, and we certainly will continue to advocate for that. But to answer to that question specifically, there is a recent survey that came out in June, a survey that was commissioned by the Black Opportunity Fund in association with the African Civic Action Engagement. And that survey comprised about 2,500 Canadians. And in that data, it shows that the vaccination of Black communities lags behind about 20%. So there is a significant hesitancy to vaccination from the Black community. Sorry?
From the Black community. So it's pretty much showing that more people need to get vaccinated. Dr. Rakuto, are people being admitted to the hospital because of vaccine complication? Can you tell us what you are seeing from a hospital perspective?
So, I'm not aware of any admissions to hospital for any vaccine complications, and certainly in Durham, there's been a large proportion, 75% or more of Durham's population that's been vaccinated, so a huge number. And to my awareness, we've not seen admissions to hospital. I know that the emergency department does sometimes see patients with reactions to vaccines, sometimes allergic type reactions, which are still quite rare for any severe allergic reactions, but sometimes there are, pains and soreness or even fevers that can be associated with the vaccine that may happen. More recently in younger individuals, typically younger males, there's been reports of inflammation around the heart, it's called pericarditis or myocarditis, which is still a very rare complication, but this occasionally does require assessment by a physician, sometimes in the emergency department, and is usually managed with some medications as an outpatient. But fortunately, given the number of people that have been vaccinated locally, we've not seen this result in any severe consequences or side effects.
That's all the time we have for today's episode of Health 180 with Carrie and Fenn on Rogers TV and podcast. My name is Carrie and Fenn, and thank you to my guests for joining us today. Thank you to Susie Scher, and thank you for joining us. And remember, together we're stronger.